Many physicians believe they're exhausted because they're overworked. Many physicians also believe that the real underlying problem isn't just workload, it's the loss of autonomy, agency, and control. What can doctors do to reclaim ownership of their careers and lives without waiting for the system to change? That's what we're talking about today. If you're a doctor, healthcare leader, or patient, you belong here. I'm Kim Downey, and this is Stand Up for Doctors Conversations at the Intersection of Connection, Courage, and the Future of Healthcare. And I'm thrilled to welcome Dr. Thiban Munnainathan and Dr. Jamie Gross. Thanks for joining us today, Thiban and Jamie.
Thanks for
Lovely to
having
be here.
us.
Thank you, Kim.
You're welcome. And by way of a brief introduction, Dr. Thiban Munnainathan is a family physician and certified physician executive with experience in clinical informatics. He's also the founder of Primetime Telehealth and Physician UX. And Dr. Jamie Gross is a practicing anesthesiologist in the UK and the founder of Medics in Control, reclaiming control over time, money, and direction in just 20 minutes a day. And I'm so thrilled to introduce you to each other. You'll both be attending our inaugural physician retreat this October. And I know this is going to be a fantastic conversation. And I do like to begin by asking you, what would you most like our audience to know about you? Thiban, would you like to go first?
Oh, thank you, Kim. I appreciate the introduction. You covered most of it. At the core of it, I love solving problems and I love helping people. And so that's why I went into medicine. But early on in my career, I noticed that some of the problems that patients were having and then some of the ways that we communicated with patients didn't really resonate with them. And that's why I went into lifestyle medicine that helped me meet patients where they are, speak their language, help them actually make changes that will last them to hopefully a lifetime. But then I realized that there are more problems in the system. And talking in the system is not something that we learned in medical school. And so clinical informatics and so becoming a certified physician executive helped me get that foundation. So now with primetime telehealth, I increase access to patients for community health centers. But with physician UX, I build tools to help clinicians, meet them at their workflow, and that supports them to make their lives easier as well.
Thank you for sharing that. That's all very important. And Jamie, what would you like us to know about you?
Yeah, so my work with Medics in Control really follows my personal journey. I burnt out in 2022. It was the worst time in my life. And I really struggled for a long time and had to take some time out and then recognize that a lot of what I was doing was based on what was expected of me and pleasing other people and jumping through the hoops and doing everything which people expected and recognizing that that didn't serve me and it didn't lead me to where I wanted to be. And I ended up reclaiming, we talked about agency, but we're reclaiming agency. A lot of it through trial and error, really. But then not only did I reclaim agency, I then built beyond that. So recognizing how difficult and challenging things were, and having had conversations with literally hundreds of colleagues since then, I recognize that there's so many, although we're all different, we all have individual stories, but there are some very common themes that relate to most of us. And obviously, we'll probably discuss it later in this podcast. But recognizing that all I do is share my journey and share my insights in the hope that it helps other people, and that's really what everything that we're doing at Medics in Control all relates to. It is allowing them to reclaim agency so that they then can build options for the rest of their life and actually do anything that they want to do.
Well, you know I love that, which is why you're leading our physician advocacy session on Sunday morning of the retreat. And the way you speak to differences and similarities is yes, every single physician is unique. Their story is unique. And there's those joint things that you've all been through and those similarities. And even the doctors coming to our retreat range from age upper 30s to early 70s. Some have retired from clinical work. We have men, women. I was just talking to Dr. Simon Craig's coming from Australia. You're coming from the UK. Thiban's coming all the way from Texas. So, all around the country, 18 states, 15 specialties, acknowledging that shared humanity in physicians, and that we need to support individuals, doctors on an individual basis, and those who want to innovate and changing the system. So thank you for sharing a bit about your story when you hit a low point in 2022. Thiban, is there a story that you'd like to share?
I noticed during COVID, that's when I became an associate medical director, and that was my first time in a leadership role. But 2019, 2020, it showed me that a lot of the workflows and the focus of building systems, they were very theoretical, and that was thrown out the window when COVID hit. We had to be practical. We have to make choices, and we had to learn while doing. So patients were giving us feedback. We had to have social distancing. We have to implement telehealth, contact tracing for patients and staff. And so we couldn't theorize anymore. We had to build systems, implement them, and get that feedback constantly. So it was a stressful time, but I think I learned a lot from that moment. And then as a patient myself, you can't help but witness what happens to you. And you could only imagine as a clinician, you're having this much struggle navigating the system. You can't imagine how much that's affecting patients who might not have obviously the experience, but also the support to help them.
Mhm. Absolutely. Jamie, if you'd like to respond to anything Thiban just said, and then tell us a bit more about medics in control.
Yeah, for sure. So, first of all, thank you for sharing that, Thiban. Really, really resonate that. I think what you're saying there, what I'm picking up from is that you can have all the frameworks and all the information about how to do things uh, as much as you like, but at the end of the day, it's about practical implementation. And sometimes you just have to figure things out, sometimes through trial and error. And it sounds like what you've done there, you're building telemedicine and lots of wonderful things associated with that. It sounds like that's exactly what you've done. And you've actually created a products and services which really have immense value, really putting patients and clinicians right in the center of it, which is what it's all about, really, is what I gather from that. So thank you for sharing that. Yeah, so talking about medics in control, yeah. So as I say, it's all about for us, really, or for me, really. I think that a lot of colleagues are kind of stuck because they're busy on autopilot essentially. So they're doing the things that they expect. Being a doctor is busy, and there's a lot of expectations that are put on doctors, and so when you're busy doing, then sometimes it's very difficult to see the wood from the trees. So sometimes what you actually need to do is almost interrupt the pattern, recognize that you're on autopilot, and interrupt the pattern. And then only when you're doing that, then you can start having a look at the bigger picture. And often the bigger picture, what I'm finding, certainly from my experience and having chatted to a lot of other colleagues, is what a career that used to be very much geared towards the patient and the doctor-patient relationship starts becoming not quite that when you're starting to apply that to individual systems, organizations and systems and targets and other pressures, etc. So what we're finding is that a lot of doctors almost become disconnected from medicine because of that. You get to a point where you start losing purpose, and you get frustrated with the system. So really, what's really interesting here is that a lot of doctors still love the clinical aspects of medicine. They still really enjoy making meaningful changes to patients and really helping them. But sometimes where the frustration lies is actually, it's not the actual medicine side of it, it's actually the organization or the system in which medicine is practiced. So that's a real issue. So with medics in control, when we're talking about reclaiming agency, and based on my experience, it's all about what we focus on four key areas. The first one is direction. So it's actually looking at what are you most aligned to? what are you passionate about? What do you want to see in the world? But then also looking at how the culture and the working environment shapes our attitudes, our thoughts, our beliefs. So a lot of that is mindset. So there's a lot of things that we do which relates to self-limiting beliefs. Also, how our time is spent as well. And what we try and do is we try and realign people's time in a way that actually works for them, not just serving the organization. What we want is really a situation where we're aligning our time that meets the needs both of the organization and ourselves. And also, we've got a financial component to it as well, because we recognize that a lot of colleagues, well, I don't know if it's the same in the US, but in the UK, a lot of colleagues feel that they can't spend more time doing what they're passionate about because of the so-called golden handcuffs and how they have to keep on working to pay the bills. And if you're in that situation, sometimes you just don't have the time to really engage into meaningful activities and areas of passion. So what we do is we combine all four of those areas, and we do it in a consistent basis using a 20-minute-a-day approach, recognizing that a lot of colleagues are time poor and headspace poor. And what we're looking to do is start building daily consistent habits which compound over time. And from our experience, having done two pilot programs, we're recognizing that once you're working on all four areas and you're applying that to your own life on a consistent basis, then you're unlocking all sorts of opportunities.
That's fantastic. Thiban, would you like to respond to anything that Jamie just shared?
Yeah, that's really impressive and keeps it so simple. 20 minutes a day. I mean, who can't afford that? And it makes a big impact throughout that entirety of that shift or that day. And I really appreciate you talking about purpose. And a lot of clinicians, they love practicing medicine. They
Mm.
love building relationships. There are days where I can see 30 patients and feel fulfilled, feel energized. There are days where I see 8 patients and I'm drained. And like you said, it's not because of the medical challenges or the medical expertise. It's really things start creeping in that you don't have control over. So administrative challenges, system challenges, and in the US particularly, we have a lot of complexities. We have the medical history. We also have the organizational internal systems, and then we have the payer systems. And two of those things we have no control over, and they constantly keep changing. And so that causes a lot of frustration. And when I spend a lot of times trying to solve those problems, it drains me because it takes me out of the zone. I mean, I love building relationships with patients. I love talking to them, with lifestyle medicine and everything too. But if they bring up an issue, such as, my medication's not being authorized, or my referral's taking a long time, or I've been trying to call the call center, no one's answering, I really don't know what to tell them because they think that I'm the system. They don't know. They think, you're responsible for this entirety. And they don't realize that I'm actually an employee here as well. And I have very little control over anything. And I'm actually on your side because I want things to work better for the rest of my patients and you as well. So that creates a lot of issues and challenges for the clinician. And I think that's what made me realize that, hey, I'm not enjoying this part of it, but I'm enjoying this part of it. And I think just having that sense to be able to identify which part really is needed from your end, like your expertise is needed versus what is just like bouncing off of you and that you have no control over. I think that helps. I think that helps you communicate with the system as well. You can tell the organization, hey, do you really want me to spend my time doing this? Or would you rather me work on the relationship, make these patients healthier, lower their A1Cs, improve their blood pressure? And so it's an important conversation to have. And I think something as simple and concrete, I mean, it's simple in terms of, there's more to it, but it's not as simple. Something as concrete as what Jamie just mentioned, I think that would be important for a lot of clinics.
Go ahead, Jamie.
No, I was going to say, thank you for sharing that. I really do appreciate that. And as I say, I think simplicity is really important because just because something's simple doesn't necessarily mean it's easy. I think one of the biggest things I've noticed is we're very, very firm believers of a consistent approach. And the reason why we say 20 minutes a day is because we recognize how busy colleagues are, and there are so many things that we do on a day-to-day basis where we don't have any control over. So the first thing we do is carve out that 20 minutes, and if you can carve out that 20 minutes, then obviously then you can start working on yourself in those four areas. Really important what you said there, Thiban, about the control versus not control, because that's exactly what this is about. What we're looking at is we're looking to redivert our time, energy, and focus on the things that we can control, and not necessarily ignore the things that we can't control, but actually most of our focus is on what we can control. And if you can start doing that on a consistent basis, and yes, it does sound simple, but in practice it's not so easy. I mean, we have a program, and the program gives the structure, the support, and the accountability for colleagues to apply that 20 minutes. And usually every week we sit down with them and say, how did your week go? Who's committed to their 20 minutes? And at the beginning of the program, a lot of them say, well, life got in the way, right? So this is kind of what we're about. It's not necessarily giving more information. It's actually saying, look, okay, well, that's the place to start then. If you can't commit 20 minutes a day, or you can't implement that, then we need to explore what's going on in a non-judgmental way. But in terms of control versus not control, I think this is important because we're talking about personal agency, but there's also professional agency as well. And there is a lot of stuff that is outside our control. And what I don't want to do is give the impression that, sort of organizational reforms and the way the healthcare runs is obviously different in the UK to the US. I'm not trying to say that's not important, because it is, but I do think that requires a lot more effort, and it requires a lot more people on board. Very difficult to change systems just on your own. You need a collaborative effort. So I think really when we're looking at reclaiming both personal and professional agency, we need a bit of both. We need to work on ourselves, and we can get a lot of traction quite quickly doing that. But at the same time, it's all about also joining a movement, which is why I love what you're doing, Kim. Stand Up for Doctors, absolutely brilliant, where we can all collaborate together, exchange ideas, and actually say, well, actually the system needs reform. That also needs to change as well. And obviously, doing a bit of both, I think, makes the biggest difference.
Yes, well, thank you. And as we're playing around with the opening question for our open space event on Sunday morning, speaking to physician advocacy, we're considering the opening question, how can we restore agency for ourselves, for our profession? And Jamie and I have talked about, of course, it all starts with self, right? And we have some doctors there who need to explore these things that Jamie's doing with Medics in Control personally for themselves. There will also be some physicians coming who have experienced coaching and are a little further along in that journey. And there's physicians who have retired from clinical practice who might have a bit more bandwidth to, as we say, eat the elephant one bite at a time, right? And start exploring. So any bucket that you're interested in exploring, you'll be able to do that at our retreat. And I love it that you're both coming. And Thiban, you shared an observation with me that physicians are being asked to solve increasingly complex system problems that they were never trained for. Would you like to expand on that a bit?
Yeah, of course. Physicians are trained to take a good history, provide an assessment, come up with a plan, and we do that. We do that really well. But when there's problems that you can't solve, you can't just say, hey, I can't solve this. I don't know the answer. A clinician could never say that, or would never say that. They love solving problems. If a patient needs help and it's still out of their control, clinicians still take ownership of that problem and they try to solve it because of their personal desire to help patients, but also everything still falls back on the clinician. The clinician's license, for example. If the patient ends up getting hurt because their medication was not refilled because of prior authorization, then it still comes back to the clinician. It's like, hey, why couldn't you do this? Why didn't you change it to this and that? And sometimes the communication is not as simple as, hey, I know exactly what's going on. There's so much fragmented messaging, and all that needs to be interpreted. So it still comes back to the clinician, and it makes it really challenging. And so that's why with all of these workflows that are broken, clinicians make an effort to fix it, but they do it invisibly and they don't broadcast it because that's just what they do. And so the system never learns that these are problems that are happening. They just think, ah, if it falls into the clinician's hands, they're going to take care of it. So we must be doing something right. And so we don't learn this, but it's who we are. And it might be adding to the system problems that we see if we don't highlight it and bring it out to the surface.
Yeah, wow. I will let Jamie respond,
Oh,
but
I
that
think I
really
think this is just here.
resonated.
Yeah, first of all, I can't speak for the US, right? Okay, because I don't work in the US. The systems are obviously very different. This is exactly what we see in the National Health Service in the UK. Okay, so give you an example. The organization introduced a new electronic health record system. There's no admin support that goes with it. Okay, it's inefficient. It serves a purpose, but it's really clunky and it's difficult to navigate. And it actually takes a lot of time and headspace away from the clinicians. Now, the physicians, because we're problem solvers, as you've said, they are going to spend their time, effort, and energy on trying to fix. You're smiling here, right? Okay,
Yeah,
because
yeah.
you know this. The time, effort, and energy to fix an inefficient system. And you're right in what you say. It's almost as if they're absorbing the organizational responsibility and accountability for an inefficient system. They didn't control that system being introduced in the first place, but they have to work with it and they have to navigate with it. They can't say we're not using it because that's not in line with the organizational expectations. So what happens there is that physicians are taking the responsibility of trying to fix this system. They haven't got the skills or expertise to fix it. And because they are trying to do their best and they're trying to fix it to the best of their ability, the organization will say to themselves, okay, fine, well, the physicians are doing enough. They're okay. Okay, we can just let them get on with it. We don't need to
Mhm.
provide the extra support and things like that because they're going to make it work. And so what I see there is that you almost got like a bit of a blurring of the boundaries between what is the responsibility of the clinician versus the responsibility of the organization. And I think where we see a few problems is where there's a bit of blurring of the boundaries as far as that's concerned. But then ultimately, as you say, the buck stops with the clinician. And if there's a patient harm, then the first thing that gets looked at is that clinician. And I think what's happening here, certainly in the UK, is that a lot of physicians are really they're struggling a bit with all of that because they're not they're there to serve patients and to look after the patients but at the same time their time and energy is focused on things that they just can't fix but they have to work with. And yeah, I think that there's a lot that can be said about this, but this is what I see.
And I just wanted to add, there's a lot we can control, but we're measured on the outcomes of these things. So it
Right.
defines us as providers and how our quality is based on the things that we have no control over. And that is really frustrating.
Yeah, and you're right, and as you say, it's the buck stops with the clinician. Unfortunately, I
Mhm.
would love to see. I'd love to see a bit more openness from organisations and much more clear delineation between what is the organisational responsibility and what is the clinician's responsibility. And I think if there's actually a clear, I don't know if it's the same in the US, but if there's clear lines between what's the organisation's responsible for and what the clinician's responsible for, I think that would be a great starting point.
Mhm. I also feel legally, though, it's hard to separate that because ultimately everything becomes the clinician's responsibility legally. So even if you separate it, the clinician would still feel like, hey, I should probably still have some control over this. That's tough.
Yeah. Kim, do
Yeah.
you have anything to say about that yourself?
Well, I mean, we're talking a lot about responsibility and control. And what you're both saying, in a sense, and which I've seen over the past few years, is that doctors have so much responsibility and so little control, real and or perceived, right? Some of it is real and some of it is perceived. And that's why we're bothering to have these conversations is to restore, physician agency and to find the things that you can control and basically taking medicine back for doctors.
Mhm.
Yeah, here to that.
And as we're seeing, even though the details are different, in the UK system is different than here. Some people here think if we just had universal health care that all our problems would be solved. But as you're sharing, it's not necessarily that way. And there's some things we can learn from different systems. And I've had on Dr. David Morris before. He's in Ireland, and they have a private system, but then also a public system that seems to be a better like catch basin for those that can't afford the private system than than we have here. So that's why I feel like when we're all getting together, because there's different states that have, there's things are different in different states and then different countries. So just if we, and physicians are so smart, if we could get you guys a seat at the table and sitting together and giving you the time and space, I think we can really move forward in some ways. So, Jamie, your core message is definitely about like control and agency and personal responsibility. Is there anything else that you would like to share that you really want to get across to our
Yeah, I would.
audience?
Yeah, thanks for giving me the opportunity for that. I think the most important thing I would like to say is that if wherever any colleague is, whether they're living the best possible life or whether they're struggling at the moment, you are where you are, and I genuinely think that anything is possible with the right approach. And one thing that I've been really amazed by is the results that we've had with our the people that are engaging with the work that we're doing. Yes, we've got medics in control, but it's actually about sharing the insights that we are all about. And I think if you're spending some time working on yourself and looking at all of the areas that I mentioned before, with the right structure, with the right support, then anything genuinely becomes possible. Because we have so many colleagues that say to themselves, yeah, I've got this for another 5, 10 years. And when I get to 5, 10 years, then I can retire and then I can enjoy life and everything else. Well, I'm not entirely sure that that's definitely the best approach. We don't know what's going to happen in our lives in years to come. We may have health challenges, for example. Life's about living. And if we're not living our best possible life, then I think the responsibility is on us to actually do something about it. And this is we give quite a clear structure of how you can achieve that. And the first place to start is actually reclaiming internal agency. And once you've done that, then you're opening up all sorts of opportunities. If you wanted to build a telehealth company like Thiban's done, you've got the opportunity to do that. You've got the skills and the ability to be able to do that. I suppose the one thing to say is that wherever you are, if you want to see a meaningful change in your life, then it is 100% possible.
I love that, and I just published an episode with Dr. Tudor Franco and Dr. Scott Miller, and that was his Tudor's take home message that anything is possible. And showing what you guys are both developing, I think that's true. And Dr. Erin Hurley, who will also be attending our retreat, and she featured me as a physician disruptor. So I'm very proud to be considered a physician disruptor. And she had shared a little video clip yesterday, and it was talking about it's okay to suck. You just have to show up. And what she meant by that, it was from someone else, but that say your goal was 20 minutes, but a day, right? But at first, even if you just give yourself a pause for 10 minutes a day, doctors
Right.
being perfectionists would think
Right.
I failed. Jamie told me to do this for 20 minutes. I couldn't even find 20 minutes. But then that's 10 minutes that you did, and you have to start somewhere. So that's what she means is it's okay to suck, but you still have to show up.
Well, very quickly, when you say suck, let me just add the first thing we invite colleagues to do: sit there for 10 minutes and do nothing, and just see what thoughts surface. Because the discomfort that colleagues face when they just sit there and do nothing is really, really interesting. Because it's not about doing more; it's actually about working smarter. And the first thing we need to do is understand what those thought patterns are. First thing we do, as I say, sit there, do nothing, and see what comes up. And that is a lot more challenging than it sounds.
I can fully relate to that. Yeah, Theban, was there any messages that you wanted to add?
hearing Jamie talk, it just gives me a lot of ideas, but also kind of reflects on what I do. And 20 minutes is important. With me as a primary care clinician, we see 20, 30 patients a day, even through telehealth and in person. So now what I do is those 20 minutes, I actually spend 1 minute extra with the patient. Before I had one foot out the door the whole conversation, because I know that more patients are waiting, things are building up, and my documentation, everything is building up in the background. But now I spend that extra minute with the patient just to be mindful with them, just to ask, is there anything else that I can do for you? Or just kind of pause, let that patient talk. Even if it's just sitting there working or putting in orders on the computer, you just spend that time with that patient. And that does add to the 20 minutes. So one way or another, I'm spending that time. Yes, it's not with myself, by myself, but I think giving that patient that extra time, that relationship just becomes the next level. And yeah, I think that really reflected with me.
Well, and now that I'm a chronic patient and I see doctors all the time and I love my doctor, so that resonates with me also and it fills my heart. Do you each have a take-home action message for our audience, Jamie, in like a sentence or two?
Yeah, I think the best thing for anyone listening to this, if people resonate with this, I think the first thing to do is really good exercise just to sit down for, I say 20 minutes, but it doesn't have to be 20 minutes. Just sit down and just write down what's occurring for you. Write down, are you satisfied? Are you fulfilled? Are you struggling? What's challenging you, etc. Just, there's no right or wrong. Just write out almost like a whole list of things that which are occurring, because usually what happens is it's about, as I say, it's about interrupting that autopilot. And the best way to start doing that is actually just to sit and just be. And that for me would be the starting point, because if you're not aware of that initially, if it's not front of mind initially, then you're just going to continue on the same treadmill of continue or this continuous hamster wheel. So you've got to break the cycle, and that would probably be the best thing that anyone can do if they're listening to this. Good starting point, anyway.
I would say absolutely awareness is the first step and not to be underrated. So thank you for driving that home. And Thiban?
I think it's to clearly understand what you've been trained to do and what you're best at. You're not the best, you might not be the best at solving system problems, but you will be the best at solving medical concerns and complexity and issues. So be able to know the difference and to, like Jamie's saying, write a list of what challenges you face that you couldn't solve because it wasn't under your control. Give that feedback to your system. As a former medical director, I wanted that feedback because I wanted to take care of the providers. But like we talked about, they take too much ownership of the problems and they solve it themselves. That never gets communicated to the administration. So to make that list or to bring that up, or even to empower the patient, hey, can you bring this up with the system, and giving them the resources and the communication network to do that, I think it really helps, so that we can kind of stop swallowing the challenges that the system is putting on us and highlight the challenges so they can solve it.
Hmm. Yes, absolutely. Well, thanks again for being my guest today, Jamie and Thiban.
Yeah, no problem. Thanks for having me.
Thank you. It's been a great chatting. Thank you, Kim.
You're welcome. So, thank you for being a part of our Stand Up for Doctors global neighborhood, a place where physicians and those who care about them can connect, empower, recharge, and celebrate. You'll find more stories like this in our White Coats book series. And if you're a doctor, we'd love to welcome you to our inaugural physician retreat this October, where these conversations can continue in person. We'd be honored to have you join us. And if you'd like to help sustain this podcast, please consider sponsoring an episode or connecting us with a mission aligned sponsor. Links are in the show notes, including how to reach out to our guests. And in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.